like to introduce you to Claudia. Claudia is one of our patients who's been going through Invisalign treatment, and she has a few things she'd like to share with you today. A few thoughts.
Thanks, Dr. Wakefield. Well, first of all, I just want to say how I'm so satisfied with my Invisalign and what has been done with the straightening of my teeth. Dr. Wakefield and her staff certainly made this a very easy process, and I am just really, really happy that I decided to have Invisalign.
Well, thank you, Claudia. We hear comments like that from lots of our patients. Will you tell us if the treatment was uncomfortable?
No, it isn't uncomfortable. Of course, when you start a brand new aligner, it's tight, it fits on your teeth snug, and so there can be some minor discomfort for the first maybe day, and then after that, you can hardly even tell that they're in your mouth, actually.
And that's a common question people have. Do other people notice that you're wearing trays in your mouth?
Yeah, I would say no. You know, initially, maybe the first day or two that the aligners are in, you might be lisping a little bit, but certainly nobody came up to me and said, "What do you have in your mouth?" You know, I mean, when I was chatting with people, I certainly said to them, "Hey, you know, I'm doing Invisalign, and can you tell?" And they were always like, they would look at my mouth and go, "Oh, well, now that you mention it, you know, I can tell." But certainly nobody came up and said, you know, something's in your mouth or something like that. So, no.
Do you have your aligners in now?
I certainly do have my aligners in right now. Yep, I do.
Very good. Did you find ever that the trays would discolor or have an odor?
No. As long as you're brushing them or soaking them in a little bit of water, you know, mouthwash kind of solution for a little bit, there was never any odor.
Was that care inconvenient?
No. I mean, of course you are most likely brushing your teeth maybe more often, that sort of thing, because you can't eat or drink anything when your aligners are in. You can drink water, but if you're going to have coffee or snack on something, you really have to take those liners out, and so it does prevent you from snacking all day long or, you know, having that extra cup of coffee in the morning, but inconvenient, no, I would say not at all.
Are they difficult to insert and remove?
Again,
if you have to do it several times a day, is that inconvenient?
You know, again, I would have to say no. Initially, when you first start your treatment, it's going to be a little awkward. And when you first put in a new tray, it might be a day because they're fitting kind of snug on your teeth. It might be a little bit more difficult to take them out, but it isn't hard. And you very quickly get the whole hang of it, and it becomes very easy, very easy.
So overall, you found the process to be
easy, simple. Dr. Wakefield and her staff just made it very, they explained everything. They showed me how to put them in and take them out, and I know that when I get done with my treatment, I can start whitening my teeth, which will be, I'm very excited and looking forward to that. So Dr. Wakefield and her staff, they're fabulous. They just make it really, really easy for you.
Thank you very much, Claudia.